Hi, my name is Marina Curiel, and I'm going to be doing my presentation on schizophrenia. Thanks. Um, ever had a day where your emotions are out of control, feeling like your day was unreal and you're not functioning normally as before? Now imagine that times 100 for the rest of your life in your daily basis. What is schizophrenia? Schizophrenia can be explained in many ways. Generally, it means an individual who suffers from an imbalance of chemicals in the brain that leads the individual to obtain stress much easier and for longer periods of time. It impairs the individual from living a normal life and makes communicating with others tougher than, than the regulars. A life like this can be very lonely and extremely stressful. In this paper, I will be explaining the condition of schizophrenia, how people or families can work with their loved ones, including communication, and ways to diagnose and manage it. In addition, I have interviewed a special person who is involved with this mental disease. Schizophrenia is a serious condition that affects the brain, impairing an individual thinking judgment, and affects how a person relates or communicates with others. As dictated from a website called invigatrinza.com. The reason why schizophrenia affects an individual is due to imbalanced chemicals in the brain, which causes an individual to have symptoms. The two symptoms are positive and negative. Positive meaning not present and negative meaning present. The positive symptoms include hallucinations such as hearing, seeing, and sensing things around you, extreme delusions, and chaotic behaviors. The negative symptoms include having lack of emotional expressions or showing feelings to others, losing interest in activities, usually things the individual partakes, in isolation, or wanting to be alone in order to feel safe and secure. Although these symptoms don't occur in everyone, they are some of the obvious. From the book The World of Psychology, the author Tori writes, schizophrenia isn't like a flood, it's madness. Schizophrenia can be caused by genetic and environmental causes. Biology is not quite destined to pass on the disease, as only 10% chance of developing can occur. Environmental causes are more of the reason why individuals are affected in today's world. Stress is one of the main beliefs in why this illness is adapting to individuals, as with stress increases the body production of hormone cortisol, which affects the brain. This illness makes people vulnerable and lacks them from trusting others or even themselves because of unable to trusting their brain. It only affects the way the affected individual lives his or her life, but the family also suffers from their mental disorder. Family, as being a number one source of to the individual, also becomes affected from the illness by stress, confusion, and having difficulty by coping. Both the family and the individual need to be prepared on how to seek help in how to deal with this condition. The family needs to remember that their loved one was like before. They need to remember what their loved one was like before the illness took over, and understand how much they have changed and might change even more. Families must start by accepting the illness and seeking professional help with family counseling and the right type of therapy. As this illness takes a huge toll on families, every member needs to avoid shame and blaming themselves for the illness, which will only make matters worse. Ronald Pies, author of How Families Can Cope with Schizophrenia, says education is certainly paramount and suggests individuals should take medication since they cannot pull themselves up by their bootstraps, or in other words, active will. As people change their moods in rapid periods of time, the older family members assume that they have an illness and self-diagnose. Individuals should always seek medical professional professionals before self-diagnosing and acting like the illness is taking over you. Just like anyone with a disability or completely healthy, the way you communicate with someone is always important. Communicating with a person dealing with schizophrenia is different than talking to a regular person. You must converse with a calming, steady tone of voice. This will allow the individual to feel secure. Always avoid baby talk, but use a gentle voice with simple sentences. Show compassion. Don't argue. Remember, you cannot change them. Be sympathetic and understanding. When communicating, limit noise and distractions to fully understand and listen to what is being transitioned. Always treat them as a person they are, not an illness. Schizophrenia can be detected with early warning signs. From the help of guide.org, some of the early signs commonly include isolation, hostility, expressionless and difficult showing emotion to others, depression, insomnia, or oversleeping, and extreme reactions to criticism. These are some of the signs that an individual should seek medical advice for. Not only are the signs tied into schizophrenia, but other mental diseases as well. Some symptoms that are tied into the disability include delusions, hallucinations, disorganized speech, and extreme behavior issues. Always consult a medical opinion before self-diagnosing. Schizophrenia is not curable, but it is indeed treatable and manageable with prescribed medication. To include more in depth of the mental disability or psychological problem, I have interviewed an individual who has onset schizophrenia. Jonathan, a 23-year-old New York City guy, has experienced the schizophrenia condition since the age of 6 and after the split of his parents. He has been medically diagnosed and refuses to consume prescribed medication for fear of addiction. Jonathan has been introduced into hospitals since the age of 13. Strapped in straitjackets, has been forced by medications to ease out, and has been in and out of juvenile centers throughout junior high and high school. After these medical visits, he believes his sickness manifested the most. Jonathan experiences extreme anger flashes, paranoia, and feels like it's him against the world. The only time which he feels the safest is when he medicates naturally. It is hard for him to trust or even be around others, which is complicated when raised in the city of New York. To close the informational topic of schizophrenia, individuals can explain what the mental disorder is, how it's caused and affects the individual or family, and how to communicate with someone that has schizophrenia, and also how to detect and manage the condition. Stay alert with your personality changes, stay up to date with medical visits, and always stay weird. Thank you.